Good morning, everyone. We will be covering professionalism in medicine, professional demeanor. Some of the learning objectives that we will be covering in this section will be explaining the elements of professional demeanor, such as respectful communication, composure under pressure, appropriate nonverbal behavior, and just discussing the importance in patient and peer interactions. Students will end up role-playing maybe some clinical and academic scenarios. We'll end up actually doing some of those ourselves throughout the course of this module, just so that you all can get a feel for what some of the scenarios may be that you will encounter in clinical practice. Some of the key components include being thoughtful and professional when interacting with patients, families, professional colleagues, or student peers, striving to maintain composure under pressures of fatigue, professional stress, or personal problems, the avoidance of offensive language, gestures, or inappropriate remarks with sexual overtones, and finally, just not engaging in romantic, sexual, or non-professional relationships with a clinical precept. What is professionalism? Well, it's essentially something that encompasses behaviors, attitudes, and values that are expected of any individual who has achieved the pinnacle of their specific field, in this case, the medical field. The importance of professionalism is that it builds patient trust, strengthens teamwork, and obviously it's going to ensure ethical and high quality medical care. Some of the influences include something called formal curriculum, which is what you're generally taught in school, in lectures and perhaps your evaluations. Informal curriculum includes mentorship and real-world learning. And finally, the hidden curriculum is essentially unspoken cultural norms. So, respectful communication obviously includes active listening, empathy, and patient-centered discussions. You want to make sure to avoid dismissing a patient's concerns, sarcasm, or even condescension, which can generally occur whenever someone is fatigued, tired, stressed, or perhaps jaded just with the overall just tenor of the job. You want to make sure that you maintain a collegial approach with peers and staff. Composure under pressure is certainly important as well. Being able to manage stress in high intensity situations, such as an ER setting, or perhaps, being called upon to help in a mass casualty setting, God forbid, but things happen. Emotional intelligence is also important. Being able to recognize your own personal biases towards someone, perhaps maybe it's a personal disagreement you had with a colleague or even a patient at times, and being able to acknowledge, the actual bias that you have towards the individual and separating that from your professional courtesy and professional designation that requires you to help out that patient in times of need. Practicing de-escalation techniques in patient care will also be important. And finally, appropriate nonverbal behavior. Certainly eye contact, open body language, professional attire, the awareness of cultural differences in body language. And finally, just respecting personal and professional boundaries. The hidden curriculum. The hidden curriculum refers to unspoken lessons learned through observation rather than formal instruction. When I was teaching this in the past, generally I always tried to tell my students that it's kind of like when you're born and you generally start to grow up as a child, you're not usually given a manual by your parents to study and then, okay, this is what you read and study in order to start building up and learning what to do in your environment. Yeah, there are certain things that happen, such as potty training, learning the alphabet, eventually learning to read and whatnot. That's handled in a more formal setting. But just thinking back, just kind of observing your parents, say like, they would take out this object that had 4 legs on it, pull it out, and they would sit on it. And what would you do? You would mimic whatever they were doing. And so what happens is we learn through observation, through hearing, through sometimes even through taste, smell, and even touch. Just through those interactions, we're able to take up a lot of information. As it happens, you continually learn like this, even later on in your college and professional lives. You see what your instructors are doing, and even though they're not formally teaching you, you're kind of still taking in the information and perhaps doing things the way that they do it. And so that's really what the hidden curriculum is referring to. Some examples, again, faculty preaching work-life balance, but models overwork. And so again, they might be telling you one thing, but you notice that they spend 60, 70, 80 hours at work or so. And so this is something that you innately pick up just through observation. Physicians, again, promoting teamwork, but belittling nurses or students. Again, these are not necessarily the best examples of this, but again, these are things that, seem to, almost be like a, hypocrisy in this case. They're being a hypocrite by telling you one thing, but then they do something else. Prioritizing patient care and yet rushing through visits due to time constraints. Again, something that's commonly seen when you all will be in clinic. And so some things to consider is, for those of y'all who have some type of medical experience, or even yourselves when you've gone to the doctor, perhaps you've observed instances where professionalism was demonstrated differently in the classroom to what you've learned compared to what you've seen in clinic. And again, how will that hidden curriculum shape your perceptions of professionalism? Again, you all may not be in clinic yet, but perhaps it's something that can spark your thoughts and perhaps lead to some inherent self-reflection before you begin your clinical practice. A case study that we have here is professionalism in peer interactions. You are a medical student on your first rotation. Senior resident dismisses your question in front of the team, saying you should already know that. You feel embarrassed but need to maintain professionalism. Well, what do you do?
Let's delve into how to handle challenging interpersonal dynamics in a clinical setting, particularly when you encounter disrespect, and how to uphold your professionalism in such a situation. How did the senior resident fail to uphold professionalism?
Well, the senior resident failed to uphold professionalism by publicly dismissing the medical student's question with a condescending remark. The response, "You should already know that," was both demeaning and it created an environment of embarrassment rather than one that fosters a learning atmosphere. Professionalism in healthcare demands respect for all team members, regardless of their level of experience, and a commitment to teaching and mentorship. This behavior undermined the student's confidence and potentially discouraged future questions, which can impact patient safety.
Why is it important for medical students to maintain professionalism even when disrespected?
Well, it's crucial for medical students to maintain professionalism even when disrespected for several reasons. The first is healthcare is a team-based environment. Maintaining composure and a respectful demeanor, even under pressure, sets a positive example and contributes to a functional team dynamic. Secondly, emotional reactions can impair judgment and communication, which can directly impact patient care. Thirdly, maintaining professionalism demonstrates resilience and maturity, qualities essential for a future provider. It also allows for a more constructive resolution of the issue in future dates. Finally, it reinforces the medical professional and it allows a respectful working environment.
What steps can be taken by the medical student to address the situation professionally?
Well, in the moment, it's best to remain calm and avoid a defensive posture or an emotional reaction. Later, it may be in a more private setting, the student can go and approach the doctor and ask them something like, I was a bit unclear as to what the topic was about. Is there any way you could clarify it for me? This will reframe the situation into a learning environment and prevents it from becoming something more emotional and potentially, something that escalates into something that it really isn't.
Next case study: ethical dilemmas in patient care. A patient confides in you that they are not taking their prescribed medication, but asks that you not tell the attending physician. You are torn between patient confidentiality and the need to ensure appropriate care. Again, what do you do in this case?
Let's explore a common ethical dilemma, balancing patient confidentiality with our responsibility for patient safety and optimal care. What ethical dilemma is the medical student facing?
Well, the medical student faces a dilemma between patient confidentiality and their fiduciary duty to ensure patient care and safety. The patient requested secrecy, but not taking medication can lead to serious health consequences, undermining treatment. The student must decide whether to uphold confidentiality or disclose for the patient's well being.
Why is patient adherence to medication important? And what are the potential consequences of non-adherence?
Patient adherence is vital for effective treatment and positive outcomes. Medications manage many conditions, they alleviate symptoms, and they prevent complications. When patients don't adhere to their treatment regimen, the medication can't work as intended, leading to worsening of the medical condition, perhaps new complications, reducing quality of life, antibiotic resistance, and finally, just wasted healthcare resources.
What steps can the medical student take to address the situation ethically and professionally?
Well, the student must first prioritize patient safety while trying to maintain trust. So, clarifying the misunderstanding, discreetly find out why the patient isn't taking the medication. Perhaps there's some side effects, cost, misunderstanding, beliefs. Educate and empathize. Gently explain the medication's importance and the risks of non adherence, validating the patient's concerns. Seek the patient's permission. Encourage the patient to disclose to their attending physician, offering support by just being present. And finally, prioritizing patient safety. If the patient is at significant risk and the patient won't disclose, the student does have a professional obligation to inform the attending physician to prevent harm.
Handling professionalism challenges under stress tends to be one of the toughest things that I have found throughout my clinical career. It's one thing to be able to handle something that's running nice and smooth. You're in a clinical setting, say an outpatient clinic. You have, say, a lobby that's maybe moderately packed with patients, but not overflowing. And so you're generally getting a steady and constant flow of patients. You're not overwhelmed. You more or less can handle everything as it comes. But the problem that happens is that sometimes these are optimal, circumstances. This doesn't always happen. And so the lobby can end up being filled. If you're working in ER, all of a sudden you get slammed with a whole bunch of patients, maybe some car accident or a series of car accidents have occurred. And so now you're having to triage patients. And so this requires you to remain calm under pressure. And so a high workload is something that can actually end up causing you to, exhibit frustration, anger, stress, and you can end up lashing out at some of your colleagues. And so you have to be able to manage multiple tasks under pressure. Interpersonal conflicts, such as navigating difficult relationships with colleagues or superiors, ethical dilemmas, facing conflicts between patient wishes and best medical practices, emotional fatigue, dealing with difficult cases without losing empathy. Another example of something that I have found myself in, especially in times when I've been feeling burnout. One of the things that you start to notice is when you've been seeing lots of patients over an extended period of time and you haven't taken any breaks, say weeks on end at this point, you've seen maybe 30, 40, 50 patients every day. You've been working 60, 70, 80 hours. You start getting to the point where you no longer care. And you have to recognize that in yourself, where it's like, it's like, this is actually important to the patient. I need to make sure to focus. That's actually the time where generally you want to make sure to catch this before it gets to that point. But if you do notice that you're there, that's where you need to take time to kind of step back and to take time to kind of heal yourself. Because what's happening is that you become jaded, you become cynical, and you're no longer paying attention to the patient's needs. This is really self-help. That's what it is. And it comes with practice. For some older students, those who have already been, in stressful environments, you all may already be familiar with this. But for those of you who are younger, again, this is something that you're going to end up recognizing as you progress throughout your clinical career. Resilient strategies, certainly important. Prioritizing sleep, exercise, nutrition, and mindfulness. I can't state the importance of this, enough. Being able to sleep properly, to exercise, to, get all your fruits and veggies. Mindfulness, maybe take time to, kind of, walk in the woods or, just walk outside your neighborhood and just listen to the birds, the wind, the trees. It helps take your mind off of whatever it is that's bothering you in clinic. Generally, I have found that long walks in, certain like national refuges, like the believe the Santa Ana National Wildlife Park. We have Llano Estero Park here in Westlaco. It really helps to kind of just take my mind off of things. It's peaceful. And I have found that it's a lot more soothing to me as an adult than it was as a child. And it helps me to actually unwind from stressful days. Again, whatever you feel is helpful to kind of recover from a stressful day in clinic, definitely try to do that because you do need to take care of yourself. Support networks are certainly going to be important. Again, we stress that even in PA school, engaging with mentors, peers, wellness programs, all of this is certainly going to be important for your own mental health. And finally, reflections. This is probably an old school strategy, but I do recall being taught this, even when I was much younger, keeping a journal, just being able to write down your thoughts. It's kind of like a way of venting the way that you feel. Instead of talking to someone, you're jotting it down, and it's one way of recording all your professional challenges and then some of the lessons that you've learned along the way. And the nice thing is that by documenting that, you can actually go back and kind of look at different things that you've experienced throughout the course of your life. Case study. Unprofessional behavior in the clinical setting. You notice that during a patient consultation, you observe your attending physician making insensitive comments about a patient's socioeconomic status in front of the patient. Well, what's the next step?
Let's tackle the critical scenario of confronting unprofessional behavior, particularly when it directly impacts patient dignity and trust during a consultation. How did the attending physician fail to uphold professionalism and ethical conduct?
The attending physician failed profoundly by making insensitive comments about a patient's socioeconomic status in front of them. This is a serious breach of respect for persons, lacking empathy, compassion, and cultural sensitivity. Such demeaning remarks cause psychological harm, erode patient trust, damage therapeutic relationships, and quite frankly, just undermine ethical obligations of beneficence and non-maleficence.
Why is it important to address unprofessional behavior, especially when it involves patient interactions?
Well, it's important to address it for several reasons. The first is patient well-being and dignity. It protects patients from harm, upholds their dignity, and ensures that they feel respected. Unprofessional comments can lead to emotional distress, reduce trust, and even impact treatment adherence. Ethical obligations. We have a responsibility to act with integrity. Ignoring unprofessionalism normalizes it and signals that it is acceptable. Learning environment and culture. It creates a harmful learning environment for students, creating an unhealthy institutional culture. And lastly, it negatively breaks down team morale and breaks down trust among colleagues. The reputation of the institution can be harmed, along with that of the entire medical profession.
What steps can medical students take to address the situation professionally and ethically?
Well, addressing the attending's unprofessional behavior will require careful thought. Here are some steps. Immediate, maybe some subtle interactions might be more appropriate, such as redirecting the conversation by interjecting a clinically relevant question or an empathetic comment. After the consultation, maybe talk to the patient and make sure that they feel respected and heard. Document objectively. You want to make sure that you took notes of this incident for your personal records. Maybe seek a private conversation with a physician to just address the impact of the comments. And finally, just talk to the physician themselves and discuss why it was that they needed to communicate that type of information. Lastly, the only thing I could say is maybe talk to a trusted supervisor, someone with whom you have some type of rapport, to address this issue through the appropriate channels if you feel that it is necessary.
Some exercises that you can use for your own reflection. You may want to identify personal strengths and areas for improvement. I remember when I was much younger, just starting off as a PA. I'll admit that perhaps I wasn't the most, I guess, empathetic person. I couldn't really sympathize with a lot of patients who had, certain, I guess, medical conditions or acute issues that had occurred to them. In some things it's just life experience. I hadn't been through them. It wasn't until I had, crossed certain thresholds in my own life that I went back and I thought on those patients, and I realized, perhaps I hadn't given the best care simply because I couldn't really, I guess, sympathize with them as much as I could now as an older adult. These aren't necessarily bad things. I mean, these are things that you learn along the way, and it helps, for personal growth as a clinician. And so again, if there are areas that are important for improvement, you can certainly jot them down. It doesn't mean that, you have to come out and try to improve them this very minute, but this is something that you can kind of focus on gradually, little by little, as time goes on. You can develop strategies for handling stress in clinical environments. If you notice that there's a certain physician that always, annoys you, yeah, you could certainly back off, and try to keep your distance from them. But if you have to work with the individual, you can take time, perhaps after a shift, and be like, sir, is something going on? Is there something that I can do to kind of alleviate the situation? I'm just not, certain that, this is the best way to continue our professional relationship. And just being able to, talk to the individual in a respectful manner is one way of actually handling stress in a clinical environment. I remember I took acting classes and drama classes early on in college, and it kind of helped to get me out of my shell. And I learned certain breathing techniques, and I would get stage fright, which is, you start getting like essentially anxious. You start having like a panic attack. So I would take several deep breaths. And so I would just kind of focus my mind and think on things that are, would make me laugh, just so that I wouldn't look at the stage and all the people that were in front of me and become scared. And those techniques ended up being helpful to me later on in clinical practice. And so again, these are all strategies that perhaps you can end up using yourself, again, as you progress throughout your clinical career. I would say also commit to one professional behavior improvement goal. I would actually go further and state maybe try to commit to one professional behavior goal, maybe once a year. Try to focus on one thing, one major issue that you feel is necessary for you to improve in practice, and try to stick with it. And then you can kind of choose something else the following year. This is one way of continually striving to be the best person that you can be, which in turn will actually end up helping you to treat patients along the way. Guiding questions, maybe how do I respond to high pressure situations, or how have you responded to them in the past? How can I maintain professionalism under stress, and what steps can I take to support my colleagues in professional growth? Some cultural competencies. Cultural competencies involve understanding, respecting, and effectively interacting with people of different backgrounds. People come from throughout the world, and they have different foods, different beliefs, different values. And so we need to be aware that individuals from throughout the world, simply because they have these different values, different beliefs, doesn't mean that they're wrong. It just means that those are the beliefs that they grew up with within their own country, within their own region. It matters because if we aren't aware of this, it can actually end up resulting in distrust between a patient and a clinician. And so being aware of this helps to kind of navigate that physician or PA patient relationship, and it can help you to establish rapport with the individual. Again, it matters because it helps to reduce healthcare disparities, improves trust and compliance, and it enhances team collaboration. Strategies that you can use? Well, avoid stereotyping assumptions. Never assume that because someone comes from a certain country or a certain region in a country that they are going to have the same cultural beliefs that you expect that an individual from that area can have. Quite frankly, they may be completely different and not have any of those beliefs whatsoever. You want to make sure that you use patient-preferred language and interpreters when available. Show awareness of cultural values in medical decision-making. Again, all of this will help you to navigate those environments where you are dealing with individuals with different beliefs. Professional boundaries are certainly important as well. You want to make sure that you maintain emotional, physical, and relational limits in patient care. Avoid oversharing personal experiences with patients. There's nothing wrong with sometimes coming out and perhaps alluding to something that has happened in your life. But, unless the individual is a close friend of yours, perhaps it's important to kind of make sure to keep that boundary there to make certain that you can end up being objective, and again, treat them in the most professional manner that's required for their own care. Avoiding, accepting inappropriate gifts or favors, becoming emotionally over involved in a patient's case. The last bullet is important because the more emotionally involved that you get, the less objective you become. It's a fact that, if perhaps, you ended up having a case of assault and it reminded you of maybe some type of assault that occurred in your own life or in a family member's life. And so you take an inherent interest in this case. Again, there's nothing wrong with that. But when you start basically delving too deep into this, you can actually end up falling too deep into the rabbit hole, so to speak, and lose sight of what it is that you're trying to do for the patient. Keeping that boundary there allows you to be more objective and avoid any emotional errors to become commonplace. How to maintain boundaries? Well, keep interactions patient-centered, avoid dual relationships, such as treating close friends or family, and seeking guidance when ethical dilemmas arise from, say, like a mentor or maybe an experienced physician in the hospital, or even legal counsel if you're working in the hospital as well. Social media tends to be quite common nowadays. I recall having Facebook, and I think I still have a Facebook page. I check it once a year. But nowadays, there's TikTok and I guess Instagram are maybe some of the more common ones that we've seen. They can be used for medical education, for networking and for advocacy, but they're also common ways in which breaches of patient confidentiality and unprofessional behavior can occur. Certainly you want to make sure to never share patient information, even de-identified cases, because there are cases where individuals have been able to determine who it is that physician or PA was talking about in a post that they put on Instagram or Facebook. You want to make sure that you maintain professionalism in personal accounts and be mindful that posts can be misinterpreted by both patients and employers. Again, if someone complains about a difficult patient on Twitter, what are the risks, especially if you're the one who complained about that patient? Navigating difficult patient interactions. It is a fact that at one point or another, you may come up to a patient who is angry. Perhaps they've had a bad experience in your own clinic. Maybe they've been waiting, hours in the emergency room, just to be treated. And so patients can be angry. They may be distrustful. They might be non-compliant. Delivering bad news or discussing end-of-life care is another way in which patient interactions can be difficult. I recall my first week of practice as a PA, delivering news to a patient who I had just met, basically fresh out of school, that they had cancer. The physician had ordered the results of a test the previous week, actually maybe the previous 2 weeks or so. They had come in, and so the patient had been scheduled for an office visit, and lo and behold, I was the one who ended up getting the visit, and they ended up having cancer, and I was the one who had to deliver it. That was somewhat of a strong conversation to have, especially for a newbie PA. Managing culturally sensitive topics is also something that can occur, in practice, and so it is something that you need to navigate delicately. Professional strategies: try to stay calm, listen to the patient concerns. You want to make sure to validate their emotions, but set firm expectations. Never lie to the patient. It's better to just tell them the truth rather than withhold information. At least that's what I found in my experience. And finally, if necessary, you can always involve supervisors or some other type of ethical consult if necessary. Addressing bias in medicine, certainly unconscious attitudes can end up affecting clinical judgment. These are things that you have to be aware of yourself, and you may not even be aware of until you're treating the patient yourself. And perhaps you may notice that you have some type of a conflict there that you can't really ascertain the reason for why it's there. But certainly there's something there. And again, it's maybe not until later on when you come home or through careful introspection that you're able to determine what is the reason for why you had such a visceral reaction towards a patient, or even a colleague for that matter. You can lead to health disparities and patient mistrust if biases aren't adequately addressed. Strategies that you can use, again, self-reflection, continuous education, using standardized guidelines for diagnosis and treatment. This is one way of treating everyone fairly, and finally seeking diverse perspectives in case discussions. Conflict resolution. Well, we know that sources of conflict can arise for many reasons. We only put a few of them here, but miscommunication is certainly one of the more common ones. Perhaps maybe you were in the lounge, having lunch or something with a bunch of your colleagues. Someone said a joke that was perhaps taken the wrong way, and now that's caused some hard feelings with certain individuals. Again, miscommunication can arise from this. Differences in clinical judgment. You feel that this individual requires a higher level of care than they are currently receiving by your supervising physician or by your colleague, and they're not receiving it. Again, this is actually a source of stress and tension that can actually occur. And finally, just the typical office hierarchical power balances, where you may end up having perhaps maybe some type of envy or jealousy that's occurring as well, or maybe just resentment that's occurring because this individual got promoted before you. Again, these are common things that happen, I would say, in every sector or industry. And so again, just have to be aware of them. This is not all encompassing. Again, conflict can arise for a multitude of reasons. Professional ways to handle conflict: active listening and understanding different viewpoints, avoiding public confrontations, try to address things privately whenever possible, and finally, using hospital mediation and ethics committees when needed. Some ethical challenges. Just I guess as it relates to documentation, you want to make sure that you're documenting accurately, because again, it's going to ensure continuity of care. It's going to protect against medical liability. Not to mention that much of the time documentation is used for billing as well. So if you're not documenting appropriately, you may be causing some errors, and you may result in either like say upcoding, or downcoding certain scenarios, resulting in either charging too much, which is usually discussed as fraud, or charging too little, which is also fraud as well, but usually not enforced as often as, say, over or upcoding. Common documentation mistakes: altering medical errors or altering medical records after an error has occurred. At this point in time, every EHR that you have, the programming that is used for it is going to be able to ascertain whenever a change has occurred. There's usually like a cookie or some type of I would say like programming code that's been inserted into the entire program that makes note of every change that occurs. So nowadays, even if you end up making a change after the record has already been signed, they can go back to the source code and they can see when that change was made and who made it. So again, this is less likely than in the past when it was paper charts, but again, it can still happen. But nowadays with electronic medical records, it's a lot easier to track down who was the individual that made the change. Falsifying patient encounters or missing information. Again, this is something that probably I don't even need to address, but falsifying patient encounters should never occur. Or falsifying, a procedure that you put down on the document that you never actually did. Again, that's just fraud at that point. And again, we've discussed over documenting or under documenting for legal reasons. You generally want to just document what's appropriate. Best practices: again, be truthful and timely with records. Try to make sure that you're able to sign them within 24 hours. Most of the hospitals that I worked at tried to give us about 48 hours to do it. I'm not going to say that I was able to do all of them in that time. There were times where I was delinquent. I was like 2 weeks behind schedule just because we were just slammed with patients. But for the most part, you want to make sure to try to sign them as soon as they occur, only because the longer the chart goes without being signed, the more chances there are that if this individual ever goes, or has a lawsuit that occurs, and this goes to something called discovery, the first thing that they're going to notice is that if this individual had a consultation on, say, a Friday, and then it wasn't signed until 2 weeks later, they're going to be asking questions. Why was it not signed? Why was this document not completed in a timely manner? Did the physician or the clinician still know what they did in the encounter 2 weeks later? Compared to if they had just finished it off 24 hours after they had seen the patient. Again, these are all things that come into play when you start dealing with, say, litigation. Seeking guidance, as always, if documentation issues arise, is always important as well. Finally, professionalism also involves avoiding burnout. Self-care is important, guys. I've had burnout before in the past. I guess in some ways you could state that the reason I'm here teaching you all has maybe a slight role to play in me being in academia. When you stop caring about patients, say that you've been slammed for weeks at a time. You've been seeing maybe 30, 35 patients, Monday, Tuesday, Wednesday, Thursday, Friday. In some cases, you've gone in for a half day to see patients on Saturday. There are times where you don't even have time to document, and so you have to document on your own time after you finish seeing the patients. And so you stay there late, you have to come in on the weekends, or maybe you just document but you're at home. And so you do this consistently, week in and week out, for like months at a time. Eventually it takes a toll on you. If you're seeing a lot of very high trauma, high acuity cases in ER, PTSD can occur. This is something that happens to caregivers. If you see a lot of patients that require a lot of inherent care, this is something that can actually happen as well and can lead to burnout. And so emotional exhaustion is really what you're looking at here. You're to the point where you no longer respond. You see an individual over there having a heart attack, it doesn't even faze you. It's like, all right, let's just keep doing it. When you get to that point, that's when you realize that something is wrong. And so you do have to make sure that you take care of yourselves. So again, emotional exhaustion is something that can lead to unprofessional behavior in the sense because you just stop caring. Physicians experiencing burnout, again, they lose empathy for patients. So there are many ways to build resilience. We talked about it previously, but sleep, exercise, eating a healthy diet, work-life balance tends to be the in phrase that I've been hearing for the last 3 years or so. If you try to strive for that, but if it gets to the point where you notice that it's affecting your health, maybe it's time to actually start seeking another job. No job is worth your own health. And so you can't provide adequate care to a patient if you can't take care of yourself. Seek support for your mentors or from your mentors, mental health services, and finally learn to set professional limits on workload. Case study, ethical dilemmas in medical education. You are a medical student completing a difficult exam when a classmate whispers, "I forgot the key details about this case. Can you help me out?" You know that sharing answers violates the honor code, but you don't want to damage your friendship. What do you do?
Let's dissect a common ethical dilemma in academia, the conflict between upholding personal integrity and maintaining social relationships, especially during high-stakes exams. What ethical dilemma is the medical student facing?
Well, the student faces a conflict between academic integrity and loyalty to a friend. Violating the honor code undermines their future professional integrity, while refusing their friend risks damaging the friendship. The dilemma is choosing between ethical rules and social comfort.
Why is academic integrity important in medical education and practice?
Quite simply, it's the bedrock of a competent and trustworthy healthcare professional. Cheating misrepresents knowledge. It potentially allows unsafe practice. You have to make certain that accurate assessment will ensure future physicians possess necessary skills for patient care. The medical profession relies on trust. Cheating erodes that trust from the start, and it demonstrates a lack of integrity antithetical to the professional. It ensures a fair environment for all students, and it respects the hard work of honest peers.
What steps can the medical student take to address the situation ethically and professionally without damaging the friendship?
Well, it's going to require a bit of care in terms of respect and clear communication. Um, Immediate refusal will probably be the best in the sense that, I can't do this. It's not right. Maybe a conversation after the exam, privately with the student, discussing why you can't actually perform this action. It's against the honor code, and it's not a personal rejection. It's just not right. Lastly, you can also reinforce the friendship by stating that, this isn't really anything personal. It's just that you can't really do this because it, again, is going to affect integrity. If necessary, and this is something that continues to occur on future, maybe exams, this is something that you can then address with a professor or a trusted source, just so that it can escalate the chain of command.
Maybe even the Professionalism Committee? That sounds about right then. Thank you.
Good.
Some questions to consider. How do you respond to ethical dilemmas? What are your professional strengths and weaknesses? Make sure that you strive to be a lifelong learner. Medicine is constantly changing, and you constantly have to keep up to date with new procedures, new methods that are being done for the same procedures, new antibiotics or other medications. These are all things that you have to keep abreast of throughout the course of your career. So make sure that you attend ethics and professional workshops, seek mentorship, and obtain professional feedback from your own work. This is one way that you can continually improve yourself. Commit yourself to growth, or make sure that you reflect on mistakes as learning experiences and support colleagues in maintaining professionalism. But finally, just some things for yourself to consider. How has your perception of professionalism changed? What challenges would you anticipate in maintaining professionalism? And how can institutions better support students in developing professionalism? Again, this is a lifelong learning process that requires self-awareness, adaptability, and a commitment to ethical practice. We will be covering respect for the rights of others in our next PowerPoint.